Why did Steve Jobs really die? At only 56 years old, so much earlier than it seemed his story should have ended. That question has circled the internet for years, because there is a real, documented contradiction sitting at the center of it. One of the most intelligent, most driven, most visionary people of his entire generation, a man who fundamentally changed how the world uses technology, who imagined the phone that ended up in nearly everyone's pocket, waited 9 months before allowing doctors to operate on a tumor they had already found. For years, some people have asked whether Steve Jobs was somehow silenced, whether there was something more sinister behind his death, something involving business rivals, hidden interests, or forces far bigger than one man's medical choices. There is no credible evidence supporting that, but the question keeps resurfacing because underneath it is a far more uncomfortable and far more real story. This video will not give you a conspiracy theory to entertain you or to feed your curiosity, because the real mystery hiding inside Steve Jobs' story is not hidden away in some secret room. It is sitting in plain sight, in a documented medical decision. Before we go further, if you want health stories explained honestly, with real sources and no sensationalism, subscribe to Dr. Michael Carter and tap like. This channel is built for adults over 50 who want to understand what actually happened and what it can teach us about our own health decisions. And before we continue, write your city or country in the comments. It helps us understand where this message is reaching. In October of 2003, Steve Jobs underwent an abdominal scan, originally to check for kidney stones. During that scan, doctors noticed a shadow on his pancreas. Further testing confirmed a tumor. Here is the detail that matters most in this entire story. Jobs' tumor was not the aggressive form of pancreatic cancer most people picture when they hear that diagnosis. It was a pancreatic neuroendocrine tumor, sometimes called an islet cell tumor, a rare and generally slower growing form of the disease. This distinction mattered enormously because doctors understood that tumors of this type, caught early, carried a real potential for surgical cure. Jobs' medical team recommended surgery as soon as possible. He did not have surgery right away. According to his biographer, Walter Isaacson, Jobs delayed the recommended surgery for 9 months. During that time, he pursued a vegan diet, acupuncture, herbal remedies, and other approaches he found on his own, reportedly including consulting a psychic at one point. Isaacson later wrote that Jobs came to regret this decision as his health declined. Jobs himself later explained part of his reasoning directly to Isaacson, in a line that has been widely reported since the biography's publication. "I didn't want my body to be opened." That single sentence captures something at the emotional center of this entire story, a fear that had very little to do with statistics or survival curves, and everything to do with a very human resistance to losing control over his own body. It's worth understanding a little more about why the specific type of tumor Jobs had made this decision on so consequential. Pancreatic neuroendocrine tumors, sometimes called islet cell tumors, account for only a small fraction of all pancreatic cancer cases, roughly 2,000 to 3,000 cases out of an estimated 44,000 pancreatic cancer diagnoses each year in the United States. Unlike the far more common and far more aggressive form of pancreatic cancer known as adenocarcinoma, where survival is often measured in months, neuroendocrine tumors tend to grow slowly. People diagnosed with this type of tumor sometimes live for many years, and Jobs himself lived for 8 years after his diagnosis, which physicians who treat this disease describe as a genuinely meaningful survival span for this condition. But that slower growth cuts two ways. It means there is often more time to act. Pause. And it also means the tumor can continue growing quietly without dramatic symptoms while a person delays treatment, exactly the situation Jobs found himself in for those 9 months. When people face something frightening and uncontrollable, there is often a pull toward finding an external enemy, someone or something to blame, out there, rather than a decision made in here. That instinct is part of why the question, "Was Steve Jobs assassinated?" still circulates. An external enemy is, in a strange way, more comfortable to sit with. If the threat came from outside, then no decision needs to be examined. But what the documented record actually shows is different. The thing working against Jobs was not a hidden enemy. It was, by his own later admission and his biographer's account, a pattern of thinking. Isaacson specifically described this period using the phrase magical thinking, describing Jobs' belief that he could control this problem the same way he controlled almost everything else in his life, through intense focus, unconventional approaches, and sheer force of will. Those same qualities, an obsession with control, deep trust in his own instincts, a refusal to follow the conventional path, were exactly what made Jobs so effective at building Apple into what it became. But a tumor does not respond to charisma, deadlines, or force of personality the way a product launch does. Most people recognize a smaller version of this pattern in their own lives. Someone who feels an occasional tightness in their chest and says, "It's probably just gas." Someone who gets short of breath climbing stairs and says, "I'm just getting older." Someone whose spouse says, "Please go get that checked," and who answers, "You're overreacting, it's nothing." The body does not always shout. Often it whispers, and many of us are extremely good at keeping ourselves distracted enough not to hear it. There's a second layer to this part of the story that is worth understanding, because it shows how far this pattern extended beyond just the initial decision about surgery. Jobs did not disclose his diagnosis publicly in 2003. It was only in August of 2004, after his surgery, that he told Apple employees directly, in an email that read in part, that he wanted them to hear the news from him personally, that he had been diagnosed with a cancerous tumor and had undergone a successful operation to remove it. Even then, the full picture was carefully controlled. In August of 2006, and again in June of 2008, Jobs appeared noticeably thin at Apple's annual developer conference, and speculation about his health spread rapidly online. Apple's public response at the time was that his health was fine. It would later become clear that his condition was, in fact, continuing to progress during this period. This pattern, presenting a controlled, confident public image while a private reality was becoming more serious underneath it, mirrors almost exactly the internal pattern from years earlier, the instinct to manage the story rather than to fully face what the story actually was. Jobs eventually underwent surgery, a procedure called a pancreaticoduodenectomy, more commonly known as a Whipple procedure, on July 31, 2004, at Stanford University Medical Center, 9 months after his initial diagnosis. The surgery appeared at the time to have successfully removed the tumor, but researchers and physicians who have studied this case point to something important. During those 9 months of delay, follow-up imaging showed the tumor had grown. It is worth being fair here and not oversimplifying the medical picture. At least one physician interviewed publicly about the case, a gastroenterologist at Cleveland Clinic, noted that for this specific, slower-growing type of tumor, a period of watching and waiting is not automatically an unreasonable medical decision, particularly if a patient has no symptoms. Medicine is rarely as simple as waiting equals UL's wrong. But many other oncologists and researchers who have examined this case have pointed out that earlier surgical intervention, before any additional growth occurred, is generally considered to offer the best chance at a lasting cure for this type of tumor. Pause. We cannot say with certainty that immediate surgery would have changed Jobs' ultimate outcome. Medicine rarely allows for that kind of clean, alternate timeline certainty. Size. But what we do know from the documented record is this: the disease continued progressing quietly during those 9 months, while alternative approaches were being tried instead of the surgery his own doctors were recommending. It's also worth noting that some experts have pointed out a separate, later decision that drew scrutiny: Jobs' choice to pursue a liver transplant in 2009 and to remain off certain standard cancer treatments afterward, which some oncologists have suggested may have been a less conventional path than typically recommended. The full details of his later treatment decisions were never made completely public, so it would be unfair to draw firm conclusions about them. But the pattern across his entire illness, a preference for less conventional approaches, appears more than once in his story, not just at the very beginning. In 2008, the cancer had spread to his liver. In 2009, he underwent a liver transplant. The disease continued to progress in the years that followed, and Steve Jobs died on October 5, 2011, 8 years after his original diagnosis, from respiratory failure resulting from the cancer's progression. The tragedy here is not that Jobs was weak. It is almost the opposite. The tragedy is that even one of the most capable, most brilliant people of his generation could be caught by the same trap so many of us fall into, the belief that we can think, will, or work our way around a problem that ultimately answers to biology, not intention. Because illness does not check credentials. It does not care whether you are a billionaire, a visionary, or the founder of one of the most valuable companies in the world. The body simply sends signals. There's a particular kind of loneliness in this part of the story too, one that's easy to miss if you only focus on the medical timeline. Jobs was, by every account, surrounded by extraordinarily capable people, doctors with genuine expertise, colleagues who cared about him, family members who were reportedly urging him toward surgery. Access to information or advice was never the obstacle. The obstacle was internal, a decision made and then defended, even to the people closest to him. That detail matters because it tells us something important. Having good information available is not the same as acting on it. Reflective. Most of us, at some point, have known exactly what we should do about something in our own health and have still found a reason to wait one more week, one more month, one more test on our own terms first. So let's return to the question we opened with. Was Steve Jobs assassinated? There is no credible evidence supporting that claim, and no reputable source has ever substantiated it. But there is a symbolic version of that question worth sitting with. If we define assassination more loosely, not as someone secretly ending a life, but as a slow, quiet process that undermines a person's ability to act at the right moment, then in that sense, something quiet really was working against Jobs. That process did not have a hidden face. It was time. It was delay. And it was the particular kind of overconfidence that whispers, "I'm different. I'll find my own way through this." That feeling is genuinely dangerous precisely because it does not feel like weakness. It feels like strength. I'm not like everyone else. I can solve this my own way. Let's just wait a little longer. Some version of those sentences can be reasonable in other contexts, but said at the wrong moment, in the face of a serious diagnosis, they can quietly take away the one thing that mattered most, the window for early intervention. It's worth being honest about why this framing, a quiet assassination carried out by delay and denial rather than by any outside actor, is uncomfortable in a way that an actual conspiracy theory is not. A conspiracy theory lets us stay comfortably outside the story, as observers of something that was done to someone else. This framing does this. Opposite. It pulls the story uncomfortably close, because nearly everyone listening to this has, at some point, made a smaller version of the exact same decision, choosing to wait, to manage things privately, to trust their own read of the situation over a professional's direct advice. Size. That discomfort is exactly the point. It's far easier to ask whether a famous person was secretly harmed by someone else than to ask whether we ourselves are currently doing something similar to our own health on a smaller and quieter scale. Before we get to the final lesson, it's worth pausing here, because this story is only useful if it helps you notice something in your own life, not just in someone else's biography. First, notice how you talk to yourself about symptoms. Do you find yourself immediately reaching for the mildest possible explanation? It's probably nothing. It's just stress. It's just age, before you've actually looked into it. That instinct is completely normal, and most of the time it is even correct. But it's worth noticing when that explanation has become a reflex rather than a genuine conclusion you've actually checked. Second, notice how you respond when someone who cares about you raises a concern. Do you find yourself getting defensive or minimizing what they've said, rather than treating it as useful information from someone with a different vantage point on you than you have on yourself? Jobs was famously described by those close to him as having what Isaacson called a reality distortion field, an ability to convince himself and others that his version of reality was correct, largely through conviction. Size. That quality served him extraordinarily well in product design. It served him far less well when the people around him were trying to tell him something he did not want to hear. Third, notice your relationship with control. Are you someone who feels a strong need to solve problems entirely on your own terms, using your own methods, before you're willing to accept a more conventional or more supervised approach? There is nothing wrong with preferring to understand your options thoroughly, or with seeking a second opinion. But there's a meaningful difference between researching your options and using that research as a reason to indefinitely postpone acting on clear medical advice. Fourth, notice whether you're substituting activity for action. Jobs stayed extremely busy with alternative approaches during those 9 months: diet changes, acupuncture, research. It's worth asking honestly whether being busy with a health-related routine is sometimes a way of feeling like you're doing something, without actually doing the one thing that matters most. None of this is about judging yourself harshly. It's about noticing these patterns early enough that they don't quietly cost you something you can't get back later. The lesson from Steve Jobs' story is not simply see a doctor early, although that is certainly the most concrete and most important part of it. The larger lesson is this: the exact qualities that make someone successful: stubbornness, a deep trust in your own instincts, a resistance to being told what to do not automatically transfer into an advantage when the problem is medical. Faced with a blood test, a scan, or a decision about surgery, instinct alone is not enough. This is why this particular story carries a specific weight for anyone over 40 or 50, because somewhere around that age, the body starts speaking more honestly. Aches that you once dismissed start to linger, disappear, and return. And this is exactly the age at which many people start quietly telling themselves, "Not yet, I'm fine," even when something has genuinely changed. But sometimes what feels like too early to worry is actually exactly the right time to act. It's worth sitting with one more detail from Jobs' story, because it adds an important layer of nuance rather than a simple, tidy moral. In his final years, after the liver transplant, Jobs continued pushing forward on major projects, including the design of a new corporate campus for Apple. He reportedly told Isaacson that if he didn't have something to work on, it would feel as though he were giving up on life. There is something genuinely admirable in that instinct, the refusal to simply stop living fully because of a diagnosis. The lesson here is not that ambition or determination are themselves the problem. The lesson is specifically about timing, about which decisions benefit from that kind of stubborn determination, and which decisions, particularly the earliest and most consequential ones, benefit far more from simply listening to the people whose job it is to know. Size. Steve Jobs taught the world a great deal. He helped teach us that a computer could be more than a machine, that a phone could be more than a device for calls. That design was not just appearance but feeling. But perhaps his most painful lesson came after his death, through the documented account of a decision he later regretted, and through that one small, honest sentence he shared with his biographer. Think for a moment about the version of this story that plays out quietly in ordinary households, far from any biography or headline. A parent who has felt unusually tired for months and calls it a busy season of life. A spouse who notices a change and brings it up gently, more than once, and is told not to worry. A person who genuinely, sincerely believes they know their own body well enough to handle whatever is happening on their own terms. Jobs' story is simply a very public, very well-documented version of a decision pattern that plays out in far quieter ways every single day in homes that will never make headlines. A checkup, a test, an appointment with your doctor. The thing that changes the course of a life is rarely a dramatic revolution. Often, it is simply making that call on an ordinary afternoon before the story has had a chance to become more complicated than it needed to be. Size. If your body is sending you a small signal today, don't talk yourself out of paying attention to it, because sometimes life does not repeat itself loudly a second time. Sometimes it only offers you that first quiet whisper, and it is entirely up to you whether you choose to listen. If this story gave you something to think about, subscribe to Dr. Michael Carter, tap like, and write your city in the comments. Your comments genuinely help shape the next videos we create, and they help us understand which stories are resonating with the people watching this channel. This video is for educational and awareness purposes only and does not constitute medical advice. It is based on publicly reported facts and Walter Isaacson's authorized biography of Steve Jobs. Some medical details of his case were never made fully public, and reasonable physicians have disagreed about how to interpret his treatment timeline. If you are experiencing any symptom or health concern of your own, please do not wait to speak with a doctor. That is exactly what this channel is here for. And it is exactly why understanding a story like this matters just as much as simply knowing how it ends.